stand.
To begin, observe the patient's gait, which should be smooth and well balanced.
Good. Now turn around and face me so I can check your posture.
Then inspect the patient's standing posture, which
Good.
should
Turn
be
around
erect
face the
and
wall so I can
symmetric.
examine your back.
The extremities should be appropriate in size and contour, with no deformities. Note how well the body parts align. The head should be directly over the gluteal cleft, and all paired structures, such as the shoulders, iliac crests, and gluteal folds, should align horizontally. The occiput, shoulders, buttocks, and heels should align vertically, and the cervical and lumbar spines should have concave curves. In an older adult, however, you're likely to see kyphosis, or increased thoracic curvature, which forces the head to tilt back. In a toddler, expect to see a marked lumbar curvature with a protuberant abdomen. Now work
Thanks.
head
Now
to
have a seat on
toe,
the table, please.
combining techniques as you assess each region. When you become more experienced, you can combine regions to minimize
Okay, now we're
position
going to
changes
continue the
and patient
examination.
fatigue. In each region, inspect the skin, noting the color and skin folds, and locating any swelling or masses. Also inspect the muscles for size and symmetry, and to detect fasciculations, spasms, and other abnormalities. Plan to palpate the muscles, joints, and bones, which should be symmetric, firm, and free of problems such as heat, tenderness, swelling, or crepitus. Assess muscle tone by feeling the resistance to passive stretch. Also test joint range of motion, noting contralateral differences, crepitus, tenderness, spasticity, or joint instability. If active range of motion is abnormal, test passive range of motion and use a goniometer to measure the angles of greatest extension and greatest flexion. Then compare the measurements to the expected angles. Also test muscle strength for symmetry and grade. Strength should be bilaterally symmetric, with full motion against resistance. Although this evaluates neurologic function, it's commonly integrated with the musculoskeletal exam. Now assess
All right, now
specific
I'm going to
joints and
examine your
muscles.
jaw joint. What
To
I'm going to
examine
do
the
is feel over your
temporomandibular
jaw
joint,
while you open and
place
close
your
mouth,
fingers in
okay?
front of the ear and slide them over the joint. As
And
the
open,
patient opens his
and
mouth,
close,
gently palpate
open,
in the joint space.
and close,
It's not unusual to hear or feel clicking,
close,
but there should be no pain,
open,
crepitus, locking, or
and
popping.
close. Okay, and open your mouth wide.
You should see a space of 3 to 6 centimeters between the upper and lower teeth.
Now slide your jaw to the right, please,
The mandible should move 1 to 2
And to the
centimeters
left.
in each direction.
and relax. All right, and push your chin forward and back.
Both
as far
movements
as it can go.
should be possible.
Good. Now I want you to clench your teeth and don't let me open them.
This tests temporalis and masseter muscle strength.
Good.
Next,
Now I need to
inspect the
examine your
cervical
neck, please.
spine
Look
from
straight
the
ahead.
front and back. It should be straight, with the head erect and properly aligned and with symmetric skin folds.
Now I'm going to examine your neck and shoulders. Bend your chin to your chest slightly. Good.
Then palpate the posterior neck, cervical spine, and paravertebral, trapezius, and sternocleidomastoid muscles. Also, check the range
we're
of
going to see
motion
how
of
well
the
your neck
cervical
moves.
spine.
Can you bring your chin to your chest?
Neck
And look up at the
flexion
ceiling.
and hyperextension should each be 45 degrees.
And then look straight ahead. Okay, try and bring your right ear to your shoulder
Lateral bending should be 40 degrees on each side.
and to your left shoulder. And relax. All right, now turn your chin to your right shoulder
Rotation should be 70 degrees on each side.
and to your left shoulder. Good. Now I need to check your muscle strength. This time when you do the movements, I want you to push against my hand, okay?
Okay.
And bring your chin to your chest.
Force from the patient's head should be felt against your hand, demonstrating sternocleidomastoid and trapezius muscle strength.
And relax. And bring your ear to your right shoulder. And straight ahead. And ear to your left shoulder. And relax. And turn your chin to your right shoulder.
Testing rotation
Good,
against
straight ahead.
resistance
And
also
chin to your
checks
left
cranial nerve 11.
Please look straight ahead while I examine your back.
Next, examine the thoracic and lumbar spine. Be sure to inspect the spinous processes of the vertebrae, paravertebral muscles, scapulae, and iliac crests. With the patient leaning forward, palpate along the spinous processes and paravertebral muscles. This should cause no muscle spasms or spinal tenderness. The same is true for percussion.
Now I'm going to tap down your spine.
To percuss, first tap each spinal process. Then percuss on each side of the spine along the paravertebral muscles with the ulnar side of your fist.
And turn to your left. Now reach for your toes slowly.
With forward flexion, you should see the lumbar curve change from concave to convex. However, you should see no lateral curvature.
And come up to waist level.
As the patient rises, you should notice reversal of the lumbar curve.
And come up all the way. Good.
Next, check
Now
the
I need
range
to
of
see how well
motion
your
of the
spine
spine.
moves. Can you bend forward and touch your toes again?
Expect 75 to 90 degrees of flexion.
And straighten up. And bend backwards as far as you can.
Expect 30 degrees of hyperextension.
And relax. Now turn and face me.
On each
And then
side,
to the right.
expect 35 degrees of lateral bending.
And to the left. And straighten up. And turn around, please. Now I need to stabilize your hips. And turn your upper body to the right.
Expect 30 degrees of rotation in both directions.
And relax.
Next, inspect the shoulder structures at rest. They should be symmetric in size and contour. Then palpate the shoulder structures,
gonna palpate the
including
muscles and
each
bones of your
sternoclavicular joint, acromioclavicular joint, scapula, coracoid process, greater tubercle of the humerus,
Rotate your
and the
lower arm up.
biceps groove. There should be no tenderness over muscle insertions.
Now let's see how well your shoulders move. Can you
Next,
shrug and hold your
evaluate the
shoulders up?
range of motion in the shoulders. Both
Good, and
shoulders
relax.
should rise symmetrically.
Now lift both arms forward, straight over your head,
Forward flexion should be 180 degrees.
and bring them back down and straight behind your back.
Hyperextension should be 50 degrees.
And relax. And straighten your arms at your side, and lift them up over your head.
Abduction should be
rest them at your
180
sides.
degrees.
Now swing your left arm across your body.
Adduction
And
should
your
be
right arm.
50 degrees.
Good. Okay, put your hands behind your hips with your elbows bent,
Internal rotation should be 90 degrees.
and put your hands behind your head again with your elbows bent,
External rotation also should be 90 degrees.
and relax. I need to check the strength in your shoulders. Can you shrug your shoulders up?
Then,
Don't
while you
push them
apply
down.
resistance, have the patient shrug and abduct his arms.
And lift your
These
arms to the
actions
side.
test the strength of the shoulder girdle
Don't let me
muscles,
push them down.
and the shrugged shoulders test evaluates cranial
relax.
nerve 11.
Now I need to examine your elbow. Can you straighten your arm at your side and have the palm face me?
The carrying angle between the humerus and radius usually is 5 to 15 degrees laterally. And you should see no subcutaneous nodules. Then, with each elbow flexed to 70 degrees, palpate the surface of the ulna. Olecranon process. Medial epicondyle and lateral epicondyle. Also assess the range of motion of the elbows.
Can you relax your arms at your side? And bend your elbows as far as they can go?
Expect flexion of 160 degrees.
And straighten them
Expect
at your
full
side.
extension of 180 degrees.
Thank you. Good. With your elbows like this, I'd like you to turn your palms down.
Expect pronation and supination of 90 degrees for
And
each
back
movement from the neutral position.
Now I need to check your elbow strength.
To
you
test
bend your
elbow
elbow
muscle
again?
strength, apply
And
an
don't let me
opposing
straighten
force
it.
while the patient maintains flexion
And now straighten your elbow and don't let me bend it.
and extension.
Good.
Next,
Now I need to examine
focus
your
on the
right hand.
hands and wrists, inspecting the dorsum and palm of each hand. Note the contour, position, and
your left.
shape of the hands, and the number and completeness of the fingers. Also, palpate each joint in the wrists and hands. The joints should be smooth and free of nodules, warmth, swelling, redness, and tenderness. Then test the
Now
range
I
of
need to
motion
check
in the
your
hands
wrist
and
finger
wrists.
motion. Can you bend your fingers down like this?
Metacarpophalangeal flexion should be 90 degrees.
And bring them up and back.
Hyperextension should be up
Good.
to 30 degrees.
All right, now can you touch your thumb to the fingertips of each finger? And to the base of your small finger? Good, and make a fist.
All movements should be possible.
And do the same with your left hand. Now I need you to spread your fingers apart and bring them back together.
The patient should be able to do both movements.
Okay, raise your arms up and bend your hands down at the wrist.
Wrist flexion should be 90
And back up.
degrees. Hyperextension should be 70
you.
degrees.
Now bring your arms up and keep your wrists straight. And bring your fingers towards each other like this.
Radial motion should be 20 degrees.
And away from each other.
Ulnar motion should be 55 degrees.
Thank you. Now I'm going to check your wrist strength. Can you bring your wrist up?
To test wrist muscle
Don't let me
strength,
straighten it.
have the patient maintain wrist
the wrist
flexion
down,
and
and don't let
hyperextension
me straighten it.
while you apply
Same
opposing
thing
force.
with the right side. Now I need to check the strength of your
To
hand.
test hand
I'm gonna
strength,
give you my fingers to
have the
squeeze,
patient
okay?
grip your fingers tightly. Finger extension,
pull away.
abduction, adduction,
Good,
and
and with
thumb
the right hand?
opposition can also be tested for strength.
Can you please lay back so I can check your hip joints?
Next, assess the hips. With the patient supine, inspect and palpate his hips and pelvis. You shouldn't feel any instability, tenderness, or crepitus. Then check
Now
the
we're going to
range
check
of
your
motion in the
fingers. Can you
patient's
keep
hips.
your right leg straight and raise it up over your body.
Expect up to 90 degrees of hip flexion.
Good. And same thing on the left. Thank you. Now I need you to roll over onto your stomach.
With the patient prone, perform the next test.
And bring your left leg back. Good, and now your right.
Expect up to 30 degrees of hyperextension. With the patient supine again, continue testing.
Now keep your left leg straight and bring your right knee to your chest.
Expect 120 degrees of hip flexion.
Good. And now switch legs. Very nice. Now I need you to swing your right leg straight out away from your body.
Expect up to 45 degrees of abduction.
And relax. And same thing with the left leg.
Expect up to 30 degrees of adduction.
Good, now bend your right knee
Expect 40 degrees of internal rotation.
and bring your right knee to your straight leg. Good, and relax. And now the same with the left. Good. All right, now I need you to put your right ankle on your left knee and let your right knee fall to the side.
Expect 45 degrees of external rotation.
Good, and now same thing with the left leg. Good, thank you. All right, now bend your right leg.
To test hip flexion strength,
Don't let me straighten.
apply resistance while the patient's hip and knee are bent.
Good, and now straighten your right leg.
To test
let me
hip
bend it.
extension strength, apply resistance while the patient
Good.
straightens
And now
his
same
leg.
thing with the left. And straighten the left leg. Don't let me bend it. Good, thank you. Now lift your left leg out and away from your body. And don't let me push it in.
Also test muscle strength during adduction.
Good, and now swing it across your body. And don't let me pull it away.
As well as abduction.
Good, and relax.
Next,
you're right.
examine the legs and knees. First, inspect the knees when extended, observing each one for the natural concavities on the front, sides, and above the patella.
And bend your right knee.
Then, with the knees flexed, note the major landmarks.
And straighten it. And bend your left knee.
Also, palpate the tibiofemoral joint, which should feel smooth and firm with no tenderness, bogginess, nodules, or crepitus. Palpate the tibial tuberosity and the popliteal space, which should have no swelling or tenderness.
Great, now I need you to stand up.
Then, with the patient standing, observe his lower leg alignment. The angle between the femur and tibia usually is less than 15 degrees. In a toddler, genu valgum, or knock knee, is common and increases the tibiofemoral angle symmetrically.
I need to check your knee motion.
Next, evaluate the
Bend your
knee's
right
range
knee,
of
bring your
motion.
heel to your back.
You should see knee flexion up to 130 degrees.
And straighten it all the way.
You should see full extension and up to 15 degrees of hyperextension.
Can you walk over to the table and hold on for support?
To test muscle strength, have the
Bend your
patient
left leg
repeat
back.
these movements while you apply
let me push
opposing
it down.
force. This may also be done with the patient seated.
And straighten the leg. And don't let me bend it. Good, same thing with the right.
Remember that among older adults, joint and muscle agility can vary greatly, especially in the knees, hips, and other large joints.
Now I need to check your feet. Can you walk to the wall and back, please?
Finally, examine the feet and ankles, inspecting them while the patient walks and stands. You should see smooth, rounded malleoli and prominent heels and metatarsophalangeal joints.
And stand there, please, so I can continue to examine your feet.
The feet should have longitudinal arches and should bear weight on the midline, which runs from the middle of the heel to between the second and third toes.
Can you please
Also,
take your
inspect
on
the feet
table?
with the patient seated. There should be no deformities, redness, or swelling. Next, palpate the Achilles tendon, anterior surface of the ankle, and medial and lateral malleoli. Also use the thumbs and fingers of both hands to compress the foot and palpate each metatarsophalangeal joint. Then check the range of motion of the feet.
Can you bring your feet up towards the ceiling?
Dorsiflexion should be 20 degrees.
And down towards the ground?
Plantar flexion should be 45 degrees.
Good. Now bending at your ankles. Bring the bottom of your feet towards each other.
Inversion should be 30 degrees.
And away from each other.
Eversion should be 20 degrees.
While I stabilize your lower legs, I want you to bring your toes away from each other.
Abduction should be 10 degrees.
And towards each other.
Adduction should be 20 degrees.
All right, now bend your toes and straighten them.
Flexion and extension should occur, especially in the great toes.
Now point your feet up towards the ceiling and don't let me push them down.
To assess ankle muscle strength, apply opposing
Point them
force
down
while the
towards the
patient
ground.
dorsiflexes his feet
Don't let me push them up.
and then plantar flexes them.
Good.
With inspection, palpation, percussion, and range of motion and strength testing, you have the skills it takes to detect musculoskeletal problems. And your examination findings, together with the health history and laboratory test results, are the first steps on the road to complete patient care.